The 10 amlodipine side effects your doctor is praying you don't discover. What if I told you that one of the most commonly prescribed blood pressure medications in the world affects nearly 1 in 4 people who take it in ways they never expected? And that some of these effects are so subtle, patients don't even realize they're connected to their medication? Amlodipine is taken by over 50 million Americans alone, making it one of the top 10 most prescribed medications in the United States. As a calcium channel blocker, it's been the go-to treatment for high blood pressure and chest pain for decades. With numbers this massive, understanding its complete side effect profile isn't just important. It's essential for anyone taking this medication or considering it as a treatment option. Now, before we dive in, I know what many of you might be thinking. Side effects are rare, and if they were serious, my doctor would have told me everything I need to know. While healthcare providers do their best to inform patients, the reality is that clinical consultations are often brief, and the full spectrum of potential effects, from the common to the uncommon, from the immediate to the long-term, doesn't always get the comprehensive discussion it deserves. Today, we're going to examine the complete landscape of amlodipine side effects, backed by clinical data and research studies, so you can make truly informed decisions about your health. Please note, this video is for informational purposes only and not a substitute for medical advice. All information provided has been carefully verified. Source links are available in the description. 1. Dizziness. One common experience when taking amlodipine is dizziness, a sensation of lightheadedness or unsteadiness. This particular side effect is often more noticeable if you are prescribed higher doses of the medication. It's also quite typical to experience some dizziness as your body initially adjusts to the blood pressure changes induced by amlodipine, especially within the first few days of starting the treatment. Fortunately, this initial period of dizziness should gradually improve and lessen over time as your system becomes accustomed to the medication's effects. You might particularly notice feeling dizzy when you transition from a lying down or sitting position to standing up. This phenomenon, known as orthostatic hypotension, occurs due to a temporary drop in blood pressure upon standing and can be more pronounced when starting blood pressure medication. To manage this, it's advisable to be careful and move slowly when changing your body position. If you do feel a wave of dizziness come over you, the best immediate action is to sit or lie down until the feeling passes completely. Ensuring you drink an adequate amount of fluids throughout the day is also crucial, as dehydration can significantly worsen any feelings of dizziness you might be experiencing. Persistent dizziness could be an indication that your current amlodipine dose is too high for your individual needs. Alternatively, it might suggest that other medications you are currently taking need to be reviewed and possibly adjusted to better align with your amlodipine treatment. 2. Edema. Swelling, particularly noticeable in the legs or ankles, is medically termed edema and stands as one of the most common side effects associated with amlodipine. This swelling occurs because amlodipine's primary therapeutic action is to dilate or widen your blood vessels, which in turn improves overall blood flow and helps to lower blood pressure. However, this beneficial vasodilation can sometimes put increased pressure on the smaller blood vessels, known as capillaries. This increased pressure within the delicate capillaries can cause them to become slightly more permeable than usual. As a result, fluid can leak out from these tiny blood vessels into the surrounding tissues, leading to an accumulation of fluid. When this fluid buildup occurs, it most commonly manifests as visible swelling, typically in both legs, a condition often described as bilateral peripheral edema. The likelihood of developing edema is generally greater for individuals taking higher daily doses of amlodipine, such as the 10 milligrams daily dose. Furthermore, an interesting observation from clinical trials is the gender-specific difference in reporting this side effect. Data from these trials indicated that women were approximately 2 to 3 times more likely to report experiencing swelling compared to men who were taking amlodipine. This suggests potential differences in how male and female bodies respond to the drug's effects on the vasculature. 3. Weight gain. Amlodipine, as a medication, does not typically cause weight gain in the sense of increasing body fat or muscle mass directly. However, you might observe a change on your weighing scale, specifically an increase in weight, if your body begins to retain more fluid. As previously discussed in the context of edema, this fluid retention can show up physically as swelling, often in your legs or ankles. This type of weight gain, stemming from fluid accumulation rather than an increase in tissue mass, needs to be monitored. For individuals who have a pre-existing condition of heart failure, any noticeable weight gain, especially if it happens rapidly over a short period of time, can be a cause for significant concern. Such rapid weight gain in heart failure patients can be a critical sign that the heart isn't pumping blood as effectively as it should be, leading to a buildup of fluid throughout the body, a condition known as fluid overload or decompensated heart failure. Therefore, it is extremely important to report any rapid or significant changes in your weight to your healthcare team while you are taking amlodipine. They can determine whether the weight gain is a relatively benign consequence of amlodipine-induced edema or if it potentially signals a more serious issue. 4. Angioedema. Angioedema is a specific and potentially serious type of swelling that can occur, albeit uncommonly, as an adverse effect of amlodipine. This condition is characterized by swelling that usually affects areas like the face, lips, tongue, or throat. Because angioedema can involve the upper airway, it carries the potential to be life-threatening if the swelling becomes severe enough to obstruct breathing. Angioedema is a documented, though infrequent, adverse effect associated with a class of drugs known as dihydropyridine calcium channel blockers, to which amlodipine belongs. These medications primarily work by relaxing and widening blood vessels. However, in rare instances, this mechanism or other drug-related physiological responses can trigger the development of angioedema. The underlying process, or pathogenesis, of angioedema involves an accumulation of fluid in the deeper layers of the skin and mucous membranes, specifically the subcutaneous or submucosal interstitial tissues. This rapid fluid buildup leads to the characteristic, often pronounced, swelling seen in angioedema. Should you experience any sudden swelling of your face, lips, or tongue, or encounter difficulty breathing or swallowing while taking amlodipine, it is crucial to seek immediate emergency medical attention, as this could indicate angioedema. 5. Fatigue. Some individuals taking amlodipine may find that the medication makes them feel unusually tired or fatigued. This sensation of weariness, lethargy, or a general lack of energy can sometimes impact one's ability to carry out daily activities effectively. Unlike certain other side effects of amlodipine that may vary with the amount of medication taken, this feeling of fatigue does not seem to be directly related to the specific dose you are prescribed. It is relatively common for many types of blood pressure medications, not just amlodipine, to cause some degree of tiredness, particularly when you first start taking them or if your dose is adjusted. Your body often requires an initial adjustment period to get used to the new medication and the resulting physiological changes, including alterations in blood pressure. The positive aspect is that this medication-induced fatigue may improve and lessen over time as your system adapts more fully to amlodipine's presence and effects. 6. Flushing. Flushing is recognized as a possible side effect that can occur while taking amlodipine. This reaction typically manifests as your skin, often on the face, neck, or upper chest, looking noticeably red or feeling uncomfortably warm to the touch. Some individuals experience this sensation of flushing as a direct consequence of amlodipine's primary pharmacological action, which is the widening of blood vessels, a process medically termed vasodilation. This vasodilation, while highly beneficial for achieving the therapeutic goals of lowering high blood pressure and improving blood flow, can sometimes lead to a temporary and localized increase in blood flow to the superficial vessels of the skin. This increased dermal blood flow is what causes the characteristic warmth and visible redness associated with flushing. The likelihood of an individual experiencing flushing appears to increase with the administration of higher doses of amlodipine. Interestingly, data collected from clinical trials also suggests a potential gender-related difference in the reporting of this particular side effect. These studies indicated that women were approximately 3 times more likely to report experiencing flushing as a side effect when taking amlodipine compared to their male counterparts. 7. Palpitations. A sensation of a fast or irregular heartbeat, commonly referred to by the medical term palpitations, is another possible side effect that some individuals may experience while taking amlodipine. When palpitations occur, you might feel as though your chest is unpleasantly pounding, fluttering rapidly, thumping, or even feel like your heart is skipping beats. This can be an unsettling and sometimes anxiety-provoking experience for those who notice it. During the clinical trials conducted for amlodipine, an observation was made regarding gender differences in reporting this side effect. Women were noted to be more than twice as likely to report experiencing palpitations compared to men participating in the studies. Furthermore, this particular side effect also appears to be more likely to occur when individuals are taking higher doses of the amlodipine medication. While palpitations can often be benign and not indicative of a serious underlying issue, they can sometimes be a sign of a more significant cardiac concern that warrants medical evaluation. 8. Nausea or stomach pain. Many different types of medications have the potential to cause some form of gastrointestinal upset, and amlodipine is not an exception to this general observation. Some individuals who take amlodipine may find themselves experiencing nausea, which is a feeling of sickness in the stomach often accompanied by an urge to vomit. While stomach pain or abdominal discomfort is also a possible side effect, these symptoms, when they do occur with amlodipine, are usually reported as being mild in nature and rarely progress to cause actual vomiting. Amlodipine offers a degree of flexibility in how it can be administered, as you have the option to take it either with food or without food, depending on your preference and tolerance. If you find that you are feeling nauseated after taking your dose of amlodipine on an empty stomach, you might want to try a simple adjustment. For your next dose, consider taking the medication with a meal or at least a small snack, as this can sometimes help to buffer the medication's direct contact with the stomach lining and potentially reduce gastrointestinal irritation. 9. Low blood pressure. The possibility of experiencing low blood pressure, medically termed hypotension, is an inherent consideration with any medication that is specifically designed and used to treat high blood pressure, and amlodipine falls into this category. The likelihood of developing hypotension can increase if you are taking amlodipine at high doses. This risk can also be more pronounced if you are concurrently taking amlodipine along with other medications that also possess blood pressure-lowering effects, as their combined impact can be additive. Common symptoms that might indicate your blood pressure has dropped too low include experiencing blurred vision and a general feeling of lightheadedness or dizziness. These symptoms occur because a lower than normal blood pressure can reduce blood flow to the brain and eyes. While these are common indicators, there are more serious symptoms of hypotension that warrant immediate emergency medical care to prevent complications. These more serious symptoms include a noticeably fast or irregular heart rate, which your heart may adopt to try and compensate for the low pressure. Other critical signs are a sudden onset of confusion or difficulty thinking clearly, and fainting, which is also known as syncope. 10. Muscle tremors. While considered uncommon, some individuals who were taking amlodipine during its clinical trial phases reported experiencing muscle tremors. These tremors can manifest as an involuntary shakiness or a rhythmic quivering of the muscles, which can affect various parts of the body. In addition to tremors, other related musculoskeletal side effects such as stiff muscles and various types of abnormal muscle movements have also been reported in association with amlodipine use, although these occurrences are also generally infrequent. These types of musculoskeletal symptoms, including tremors or stiffness, can be quite unsettling for the person experiencing them. They may also interfere with the ability to perform daily activities that require fine motor control or smooth, coordinated movements. If you happen to notice the onset of shaky or stiff muscles, or any other unusual or new changes in your muscle control, coordination, or general movement patterns while you are taking amlodipine, it is very important that you report these observations to your prescribing healthcare provider right away. Thank you for watching and supporting our work. If you found this helpful, please give it a like and subscribe for more content like this.